What do I recommend as a GI doctor for some potential supplements that have been shown in some clinical trials to help out? Well, let me talk about them. There are 5 main supplements I recommend to my GI patients and to anyone in general that have been shown to really help out with living a better life, but also to help out with your gut health as well. Number 1 is melatonin. Melatonin has been shown in a lot of clinical trials to help out with reflux, with IBS, with sleep, with Crohn's and colitis. There's very good evidence that melatonin is a beneficial supplement for a lot of our individuals who are suffering from chronic GI problems or who also suffer from chronic sleep issues as well. And in most individuals, it tends to be very, very safe. You take it at night, typically 3, 6, maybe even 9 milligrams, and it can work out well if you have chronic conditions to help improve what's going on and to make things better. But as always with every supplement, make sure you speak to your healthcare provider. Number 2, magnesium. Yes, I'm a big proponent of magnesium, but I'm a big proponent of magnesium under the supervision of a healthcare provider because you can overdose from magnesium. But magnesium has been shown to help calm people down, to help out with anxiety, to help out with a lot of stress. It's also been shown to help out with bowel habits as well. In fact, I have found that magnesium is a very effective supplement to help soften your bowels, to make it easier to go. If you add this to fiber, it's a wickedly awesome combination to have you have a very effective bowel habit. Sometimes I recommend maybe 2 to about 4 or 6 milligrams at night, pills at night. But once again, this needs to be under the supervision of a healthcare provider because I can just check your magnesium level to make sure you're not too high, to make sure you're not having any toxicity as well. Sorry guys, my nose is very stuffy. Number 3, vitamin D. We're seeing more and more evidence that vitamin D can play a role when it comes to gut issues, and more evidence that people who are deficient in vitamin D can be more likely to have Crohn's, more likely to have depression, more likely to have celiac disease and IBS as well. So for a lot of my patients, I recommend for them to be on a vitamin D supplement to help out with their gut issues and hopefully improve what's going on in their gut microbiome as well. Number 4, turmeric or curcumin. This is a very effective anti-inflammatory supplement. I recommend the actual powder over the pill. Add this to coffee, add this to your food. There are so many good studies that suggest that this can actually decrease inflammation inside your body. If you're feeling inflamed, feeling like you have brain fog, joint issues, arthritis issues, Crohn's or colitis, it's very effective, it's very natural, and it can really help you to help improve the inflammation that's going on and to hopefully improve what is going on inside your GI tract as well. And then lastly, number 5, I'm going to give you a little trick here. Water! Yes, water is a supplement I think that a lot of people do not realize is such an important part of your everyday health. You need to drink a lot of water. In fact, I would recommend having at least 2 glasses of water per meal, 1 glass in the morning and 1 glass before you go to bed. This will give you enough water to sustain you, help flush everything out, and there's nothing bad with having that much water. It's going to improve your health, it's going to improve your skin, it's going to improve your gut health, and make you feel better as well. But these are the 5 supplements I recommend when it comes to gut health, and I've found that for a lot of my patients, it can make them feel a lot better.